Hello, I'm Lori Steiner, sitting in for Armin Budish. Welcome to Golden Opportunities.
Today, we'll get to the heart of chest pain. Then, our dentist will polish us up on ways to help teeth look younger than springtime. We'll paint a beautiful picture of the new Rembrandt exhibit. Plus, depression is more than being down in the dumps. We'll raise your awareness. And make sure you protect as much of your life savings as possible if you or your spouse need a nursing home.
It's time to get GOing, so pull up a chair and join us at our kitchen table for Golden Opportunities. Something in your chest doesn't feel quite right. Could you have pulled a muscle out on the golf course? Or maybe it's just indigestion from that Mexican dinner you had last night. Still, what if it's something else? What if it's your heart trying to send you a message? Dr. Grace Cater is a cardiologist with Metro Health, and she's here to help us figure out when something is nothing and when something needs immediate attention. Thank you so much for being on the show. This is an important topic. We're talking about our hearts. When we have symptoms that involve our chest specifically, does that always mean a heart attack?
Well, symptoms in the chest can come from any organ that is located in the upper part of the body, and that may include the heart, the lungs, the muscles, the ribs, the esophagus, which is the swallowing tube, and or the digestive system. While most of the causes of chest discomfort is probably not from the heart, however, still any new chest discomfort that is occurring in the chest area, especially if it's associated with other symptoms of shortness of breath, neck discomfort, may be coming from the heart, and that is very important to get it checked right away.
Okay, so you mentioned shortness of breath, so discomfort in the chest and neck and shoulders and your upper body part. What other symptoms go along with that typically?
Sometimes also people may feel fatigued, unusually fatigued. They may feel dizzy, they may feel lightheaded, they may break out in a cold sweat. So these are other symptoms that may occur with that.
Okay, and those are, everybody would kind of recognize that something is wrong going on there. What does a heart attack, though, feel like? We talked before, that is not necessarily what you feel with a heart attack. So what do many people also feel?
Well, also people, sometimes they may feel the classic symptoms, which is that sudden severe chest pressure or tightness that spreads suddenly to the rest of the upper body. But sometimes also they may have just only the nausea, or only feeling short of breath, or only having indigestion, or only having some neck or only jaw symptoms. They sometimes think it's a toothache, that it comes and goes. So these are some of the warning signs, as we say, of potentially heart disease. And we see that sometimes in women and also in older folks, they may present with these kind of unusual symptoms.
Okay, so you don't always know what's going on.
That's right.
If you're having some issues, but you're not really in that much distress, I mean, is it okay to have somebody drive you to the hospital?
No, absolutely not. It's really very important that you do not drive yourself, nor let anybody else drive you. And the reason being is, if you are having a heart attack or you're having forewarnings of a heart attack, you may have a cardiac arrest, and that person who's driving you is not going to be able to help you or save you.
Okay, well, that would be bad, especially if you're trying to drive yourself.
Absolutely.
Do you have some people who try to do that?
Of course we do. Of course we do.
Hopefully they realize it's not a good idea for them if it comes the next time. You also have a saying that you said, time is muscle, time is life. What exactly does that mean?
Well, it means that when somebody is having a heart attack, there is a sudden cut-off of oxygen to the heart muscle, and that can cause electrical instability in the heart muscle, and people can have a cardiac arrest, and most of the time they may not make it, especially if it happens at home or outside of a hospital setting. But also when people have a heart attack, they may end up with a significant heart muscle damage, and in the future they may have symptoms of congestive heart failure, and also if that heart muscle does not recover completely, they may still have a cardiac arrest. So they are not out of the woods, and that's why the goal is to prevent a heart attack from happening in the beginning, and that's why we say time is muscle, time is life.
Okay, so the faster you get treatment, the better off you are.
Oh, absolutely. Actually, the time between getting symptoms and getting that artery open to restore blood supply, the better the outcome and the more survival that we see.
Okay, great information. Very important for our viewers. So if you're worried about your heart, Here's something you can do. Attend a pep talk given by Dr. Cater and get to the heart of the matter. Just use the information that's coming up next. My thanks to Dr. Cater for giving us many somethings to think about.
Yeah, thank you, Lori.
Learn more about recognizing the warning signs and preventing a heart attack by joining Dr. Cater and Dr. Holly Persy at a free Metro Health Pep Talk on Thursday, April 5th at 6:30 p.m. at the Strongsville Library. Call 216-778-1220 to register or log on to www.metrohealth.org/Pep Talks. Next, spring has sprung. Can your smile blossom too?